Inside Gaza's largest and most overwhelmed hospital, a war is being fought every minute. Not with weapons, but with bandages, breath, and heartbreak. The ICU is on the brink of collapse. We spent hours inside with Dr. Ahmed, who's operating under conditions no doctor should face.
To watch these people with their amazing hearts come to work, knowing that the stress and strain and burden of knowing that their children don't have food or they have to think about what's going to happen tomorrow, on top of that they come here and continue to care, I never thought that could be possible.
There are no moments of calm here. Doctors work non-stop, moving between patients with extensive internal injuries or crushed limbs to those with third-degree burns or shrapnel wounds from Israeli airstrikes. Dr. Ahmed tells us many of these patients would not survive, even in a well-equipped hospitals. Here, survival depends on what he and his team can improvise.
We see skin and bones and ribs, and we see temporal wasting, which is wasting away of the fat pads, and we see sunken eyes, and we see all the things we learn in textbooks about malnutrition. We see in every person here, doctor, nurse, and patient. And now we take the patients who on top of this have suffered devastating traumatic injuries, and their capacity to recover is close to zero.
There is a critical shortage of basic medical supplies, including anesthetics for major surgeries and gauze for dressing wounds, as well as equipment like ventilators. Doctors are reusing gloves, cleaning surgical instruments by hand, and treating patients in a war built for less than half that number. Dr. Ahmed says this mission, volunteering in the heart of collapsing health system, is the most difficult thing he has ever done.
Patients come and doctors know if they have a certain level of injury, there's nothing we can do. And to face families and to face patients in the last moments of their life and not be able to do the things we were trained to do is devastating.
The Israeli military stormed the Shifa hospital twice. During those 2 times, it destroyed all of its major departments and critical facilities, including the intensive care unit. This particular critical facility in the hospital has been rehabbed and put back on track to provide much needed medical care to the injuries that keep pouring into the hospital. Meanwhile, every other building inside the hospital is still standing in ruin. And as of this moment, not only it needs the support, but also the protection, the supplies, and more importantly, an end to the genocide. Hani Mahmoud, Al-Jazeera, from Gaza City, Palestine.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news, expert insight. Like, share, stay ahead.